If you can get the best regime for a patient, then that has to be better. I can illustrate that with examples of, say, looking at the work of an HIV pharmacist, where their job is to work with a patient to optimise what are very complex medicines with a huge number of interactions.
We had more admissions due to COPD and asthma than our regional and national average. And we felt there was an opportunity for community pharmacy to become involved in optimising the use of those respiratory medicines, looking at the evidence and recognising that inhaled therapies weren't always taken correctly and that many patients didn't know how to use them.
We've been working with Professor Richard Gray, who's a Professor of Nursing in Bristol, and we're really trying to push out adherence therapy training, particularly aimed at our early intervention services, and it's had a really dramatic impact, not just on pharmacy, the pharmacists within the team, but the nursing, making them realise they never really asked the patients what they believed about their medicines, how they were coping with medicines, what were their own barriers. Nobody listened, and patients are they've been inspired really by the improvements they've seen in some individuals by taking this new approach.
I am encouraging our pharmacists and technicians now to actually call people into the clinic and discuss what they're planning to do, such that they can actually listen to the patient and understand how the changes that they're discussing may affect that patient and take their views into consideration. And I think we've missed that historically under medicine management.
Maybe as medicines optimisation goes forward and we're using community pharmacies more, then we should be able to follow those patients further. If I take my medicines for the elderly pharmacist or old person's medicines pharmacist, they now have set up a scheme whereby they're notifying the local GP and the local community pharmacy of the patients that are coming out. I have pharmacists who run pre-assessment clinics now and book patients in, and we'll run through their medicines with them prior to admission so that we ensure that we give them continuity of care when they come in.